Carpal tunnel syndrome is numbing, tingling, and weakness of one or both hands. And this usually affects the thumb, the pointer, the middle finger, and part of the ring finger. And the reason for this is because the median nerve, which supplies those fingers, is usually what is affected, what is compressed. So some of the activities that causes carpal tunnel syndrome are repetitive activities such as typing, gardening, or activities that require you to do a lot of flexion or extension of your wrist. And the reason being is because when you do those activities for a prolonged period, what happens is those tendons, they get inflamed. So when they're inflamed, they swell up and then they cause compression to the median nerves, and then you get the symptoms. So I'm going to talk about some of the things you can do at home to help decrease some of those symptoms. So I just talked about inflammation of the tendons, and that's why it causes compression to the median nerves. So what we want to do is decrease that inflammation so that we can decrease the swelling. And by how we do that is we ice 10 to 15 minutes several times a day, and that should keep the swelling down. So the next thing you want to do is brace your wrist. By bracing your wrist, you're going to keep that your hand and your wrist in neutral position. So you're not going to be extending or flexing so much, and it's going to prevent, and you want to do this throughout the day and even at nighttime so that it prevents you from curling your wrist while you're sleeping. So next thing I want to show you is something you can do at home to decrease the numbing, tingling sensation in your hands. So a lot of times what happens is you have 8 bones in your hands, and these bones, they can misalign. So when they misalign, they can cause compression to the median nerve and cause you to have symptoms. So what I'm going to show you is is called impulsing to your wrist, something you can do at home. So all you're going to do is you're going to extend your hand out and extend your wrist, and you're going to put your thumb right on top of your wrist here, and you're going to grab your hand with your other fingers, and you're just going to kind of do an impulse like that, just a light impulse, just throughout your wrist, throughout your hand here. So it's not something that you're going to press really hard on, but you're just going to lightly do this throughout your wrist, and that should help kind of put those bones back into alignment and maybe even help decrease that numbing, tingling sensation. So what holds the carpal tunnel together is the transverse ligament. And I'm going to show you a way to kind of stretch that transverse ligament out so that it can open up more and there's a little bit more room for the tendons and ligaments. So all you're going to do is you're going to hold your hand out like this. You're going to put your finger right in between, right in the middle of your wrist, and you're just going to extend your wrist, and while you're extending your wrist, you're going to pull down. So you're just going to extend, pull down, extend, pull down, extend, pull down. Do that maybe 10 to 20 times, and that's it. And if you have pain while doing any of this, don't continue doing any of the exercises. So next thing I want to show you is stretching of the median nerve. So first you're just going to bring your arm back, and then once you feel your pec muscle stretch, that's good enough. And next you're going to extend your wrist. So if you extend your wrist, you feel that stretch of your median nerve, and you feel it. If it feels uncomfortable, then that's where you want to go. And with this, you want to go light and slow because we're not stretching muscles, we're stretching the nerve. And you hold this for maybe 10 to 20 seconds, and then relax and do it again a couple times. And you can do this a little bit further by leaning your head away from your wrist, away from your shoulder, and that's going to increase the stretching of the nerve. Again, I want to remind you, you don't want to go fast with this because we're not stretching muscles, we're stretching nerves. The last thing I want to show is just some stretches to the forearm muscles. The forearm muscles, they tend to get tight with carpal tunnel syndrome. So what you're going to do is you're going to bring your hands together like this in a prayer pose, and then you're going to bring it down, and you can feel that stretch right along these muscles here. Just going to hold that for 20-30 seconds and then relax, and then to stretch these muscles on top, you're going to do the reverse prayer pose here. And then you're going to bring it up like this. And you can feel those stretch as well too. So 20-30 seconds, a couple times, maybe 3 times each throughout the day, and that should help a lot with decreasing that muscle tension of your forearm muscles. So thank you for watching. If you like the content and if you enjoyed the information that I've given you here, please like, subscribe, and share my channel. I appreciate it. And until I see you guys again, take care.